Archdiocese of Chicago is a vibrant and diverse faith community. We celebrate our faith through worship, evangelization, and reaching out to the needy. Welcome to Catholic Chicago.
Good morning and welcome to the Voice of Charity. I'm Katie Bredemann and we are delighted to be here with you again this morning, broadcasting from the brand new Francis Cardinal George studio at the Archdiocese of Chicago. This studio was made possible through a generous donation from Mr. Terry Shin and his late wife Catherine. And we at Catholic Charities are honored to be among the ministries of the Archdiocese of Chicago that are sharing their stories through the state-of-the-art studio. The Voice of Charity welcomes everyone who is listening on WNDZ 750 AM here in Chicago, and all who are watching our live stream on YouTube and Facebook at Catholic Chicago. As we've discussed here on the Voice of Charity before, Catholic Charities Behavioral Health Services does an outstanding job of helping individuals, couples, and families deal with a wide range of mental health concerns. Catholic Charities staff members who work in our counseling programs are compassionate, experienced professionals who last year accompanied 2,400 adults and children on their journey toward healing and wellness. What you may not know is that Catholic Charities Behavioral Health Services have evolved quite a bit over the years. And here to describe that evolution are two skilled, highly respected behavioral health directors who have each devoted more than 30 years to this vital work at Catholic Charities. Welcome Pam Davis and Hector Rivera.
Thank you.
So delighted to have you here with us this morning. It really is a privilege to speak with both of you here today. Together, you have over 60 years of experience working with people who come to Catholic Charities for assistance with their mental health concerns. Can I ask you each to please share with our audience how you first got involved with Catholic Charities? Pam, may I start with you?
Absolutely. I was a year out of college when I moved to Chicago from out of state. My previous experience had been working in a nursing home as a social worker. So when I moved to Chicago, I wanted to work with seniors. I wanted to continue that work, but maybe prevent the need for nursing home care. So this was before the internet, and what I had to do was go to the Blue Book, as it was called, which is the Directory of Human Service Organizations. And from that book, I was able to identify organizations that serve seniors, and I blindly sent my resume to many of them, and was my amazing good fortune that I got a call from Catholic Charities, and then shortly after was offered a job. And here I am 32 years later. I never could have imagined that this would lead to such a fulfilling and amazing career.
Well, Catholic Charities is the lucky one, I think.
No,
how about you, Hector? How did you first start with Catholic Charities?
So I majored in social work in undergrad and needed an internship, and I did my internship with Catholic Charities, and as soon as I graduated, they offered me a position as a caseworker. So I worked with them for 3 years in their foster care department. They actually at the time really encouraged and subsidized pursuing a higher education. So I returned to school to receive my master's in social work, and worked as a caseworker for a very brief moment, and then became a therapist. And then over time, I moved into a supervisor position. So Catholic Charities has been so grateful that they've really supported my education and career.
Well, you've done tremendous things at Catholic Charities. We're so fortunate to have you both in these key leadership positions. Can you tell us a little bit about what was the Behavioral Services Department like when you first started, Pam?
When I first started, behavioral health as we know it today didn't exist as it was. It was it was spread throughout the agency. So for example, after I worked with seniors, I went back to school. I had great generous support from the agency as well. I got my master's degree, and when I came back, I was a counselor in Family and Aged Services, which was a program that worked with economically disadvantaged families that were facing barriers to becoming self-sufficient. They did not have a way to pay for services, and we provided comprehensive, holistic case management and counseling services to them. And then there was a sister program that provided counseling services to people who who did have more resources, who had insurance and could pay for services. And that was more traditionally office-based, whereas Family and Aged was providing services that were community-based.
And Hector, you had mentioned working with foster children. Was that a significant portion of the Behavioral Health Services Department when you first started?
Yeah, so when I started at Catholic Charities, there was no behavioral health services. We were mostly sending referrals outside of the agency to other counseling programs. Very little time did we refer internally. It wasn't until I came back from school after receiving my master's degree that the foster care contract increased and they were able to build internally counseling services for youth and their parents and families who were involved in the child welfare system.
Well, and I'm guessing too that the expansion of behavioral health services, part of that is so important to the growth of the family, right? That when they see progress from a behavioral services standpoint, relieving people's mental health concerns, then they have a much more positive, clear thinking mind to improve other aspects of their life. Am I right?
Yes.
Yeah. Mm-hmm. So are there any events or milestones in the history of Catholic Charities that are especially memorable to you, both of you, who have been with Catholic Charities for more than 30 years, both in the growth of your department and the agency overall?
I'd like to start with some external changes and factors that impacted behavioral health treatment in the country and then certainly at Catholic Charities. And one of those the first one was the Mental Health Parity Act in 1996 that required insurance companies to provide behavioral health services at the same rates as they paid for medical care. And then that act was also tweaked in the early 2000s. And then a couple of years later, in 2010, we had the Affordable Care Act, which required all Americans to have health insurance and also to allowed the states to expand Medicaid. So many more people in this country had access to health insurance and were able to access mental health services.
Well, and it was just a growing awareness of how unbelievably important mental health is to someone's overall well-being, right, Hector?
Yes, in fact, when foster care closed, Catholic Charities maintained the counseling portion of foster care because they knew how important it was. So at that point, we were able to start putting up other systems and gaining other contracts where we were able to work with more children. And then eventually, in 2017, 2016, we started expanding with grants and contracts, not only with youth, but families and also with adults. And then Pam mostly worked with adults who needed behavioral health services. I worked mostly with youth. And then a couple years ago, Catholic Charities decided that it was a better idea, which was a lot more logical, to bring us all together. This way we can use all of our staff to work with all age ranges.
And are there any events or milestones in your career, Hector, that you also feel were significant to the growth of the behavioral health services impact area, but also just to the growth of the agency? Any specific things come to mind?
I think it was being able to tap into more grants that really was focused on helping children and adults who were victims of crime. That was part of it. I think Pam also did point out a lot of the societal things that were happening as well that added to those changes.
I would add the pandemic really changed behavioral health services because of what everybody was going through during the lockdown, and then the focus on social and health inequities. The stigma was reduced, and it made it easier for people to ask for help. And then also during the COVID emergency, a lot of federal and state laws were changed to offer flexibilities in providing care. And that is how we ended up doing so much telehealth. And now that's a permanent thing that's available to people. So it makes it so much easier for people to access services.
Well, in telehealth, like you said, it was one of those things that people might have been a little bit reticent, to try before, but the pandemic kind of forced it, and people saw the advantages of being able to log into a session right from the comfort of their own home. And people are so busy today, it probably saved time and an effort and made the whole process of engaging with people much easier, right?
Absolutely. It was a game changer for people who needed services.
That's
and
wonderful.
couldn't get them before.
That's wonderful. And I know that you each probably have so many hundreds of stories of clients that have, left a lasting impact on you. Are there one or two that each of you could share that would help our audience really appreciate the range of concerns that people come to Catholic Charities with, but also how you've been able to help them? Pam, can I start with you?
Yeah, sure. It's really hard to choose one. I've been just the privilege to walk through and accompany, as you said earlier, our clients through some of the darkest times of their life. I have learned from each of them, and I have grown, and I hope I've given them just some of the same.
I am quite sure you have. You're such an experienced, compassionate person that I think that anybody who walks into a room and sees you, or walks onto telehealth and sees you, is a very lucky person indeed. How about you, Hector?
I may echo Pam on that. It's so hard to really pinpoint one story or just a couple stories, because there's so many. But I think the biggest thing that I've learned from working with all of our clients, both youth and adults, is just how resilient humans can be after experiencing so many difficulties and traumas in their life, and that they're able to still find joy. And bring that joy into the sessions. Like Pam said, it's been such a privilege to be able to work with so many people and colleagues as well.
But I also think a big part of the success of what you do is your gentle but effective professional way of helping people talk about what they've been through, right? Because isn't that part of a big hurdle, that just getting people to open up and be comfortable sharing what they experienced and what they're feeling is probably a big part of what you do, right?
Absolutely. Building the relationship is pivotal. If we don't have a relationship, it's hard to help facilitate the healing.
And so just building that relationship could take weeks or months in itself, right, Hector?
Very much so, yes. I think that's one thing that with working with youth who have experienced multiple negative traumatic experiences, that trust is so important that it can. I mean, there have been clients that it's almost taken a year to build that trust to get to the essential work that they need to continue coping and become successful in life.
Well, it's vitally important, fascinating work that you do, and we've shared some about your early years with Catholic Charities, and if you'll please bear with us, we're going to take a break here on the Voice of Charity, and when we continue, we're going to continue our conversation with Hector Rivera and Pam Davis about Catholic Charities Behavioral Health Services and the goals for the program now, and how they help people overcome a wide variety of mental health concerns. Thank you for being with us, and please stay tuned.
Catholic Charities Loss Program was created more than 40 years ago to help survivors of suicide wherever they are in the grieving process. This nationally recognized program continues to offer a safe, non-judgmental environment where survivors of suicide can find community, direction, and resources for healing after suffering the devastating loss of a loved one. Online and in-person services are available for individuals, couples, children, and families of all faith traditions. To learn more, call 312-655-7283 or email loss@catholiccharities.net. Don't suffer alone. We are here to offer loving outreach to survivors of suicide. Contact Catholic Charities today.
People always say, how can you spend your day with 3-year-olds? Seeing the changes that they go through and just the journey and how they grow, this is a very rewarding job. Even though at the end of the day, we're not the highest paid people on earth. And when I have a parent contact me and say, my child loves school, that to me, I'm setting that foundation for their love of learning, because really you are changing lives, you are molding lives.
Shape the next generation of leaders. Teach. Apply today at archchicago.org/schooljobs.
Did you know that Catholic Charities accepts car donations? If you're ready to free up space in your garage and put a stop to all those expenses that go along with owning a car, we will gratefully accept your donation, whether the car is running or not. You choose a pickup time that is convenient for you, and we will make the donation as easy as possible, free of charge. You'll receive a charitable donation receipt as well. We accept all types of vehicles nationwide, and you will know that your donation is made to Catholic Charities, an agency you can trust. To learn more about donating your car, call 877-786-4483. That's 877-786-4483. Thank you.
Welcome back to the Voice of Charity. I'm Katie Bredemann, and it's my great pleasure to be here today with Hector Rivera and Pam Davis, two directors in Catholic Charities Behavioral Health Services Department. And we're talking about the evolution of this behavioral health services area and also where the program is today. And so I wondered, like before the break, we were talking about how resilient that the Catholic Charities clients are and how much you actually admire their courage as they're trying to deal with their different mental health concerns. But I wonder if you could sort of summarize for our audience what the main goals are right today of the behavioral health services area. Pam, can I ask you to answer that?
Absolutely. As Hector mentioned, we merged our child, youth, and our adult programs about a year and a half ago. And since then, we really want to continue to increase and support a workforce that can provide services and meet the demand throughout Cook and Lake County and throughout the lifespan. So that's been a big focus of ours for the last year and a half and continues to be. Also, we want to create an intake system that is, we want to enhance our intake system, I should say, because we want it to be quicker and easier for our clients so that they can start services as soon as possible. So that's something we're starting to really focus a lot on. And lastly is we want everybody that works at Catholic Charities and all the different programs to be aware of behavioral health services and what's available so that we can make them available and clients throughout the organization will have access. And right now, not everybody does know.
Well, and that's a great point, because when you are referring people from one program to another and people are asking, oh, can they offer this program or this service, you're right, the awareness is so important in an organization as big as ours with 1,200 employees, right?
Yeah.
And so, and along those lines, I know another goal is to meet clients where they are, right? To get to know someone well enough, so that you can identify the root causes of maybe their concerns and figure out the best way to start the healing process,
yes.
right?
Yes.
And so, Hector, when people come to Catholic Charities, is there one main office they come to for counseling program, or what can you offer them in terms of availability of sessions, of meeting with someone to speak with them?
Most of our programs are located at an office on the near west side around Roosevelt and Ogden. However, our staff are also deployed to different satellite offices throughout Cook and Lake. I believe we're in a total of 8 different sites where we can offer those services, and again, virtually as well.
And so clients can have a choice of how they receive the services, is that correct?
Yes.
Okay,
yes.
Great. And you've mentioned to me before, Hector, I find it so fascinating, that oftentimes you try to assist people if you see that they have been through a very difficult experience, either one very difficult traumatic experience or numerous ones, that there's actually a therapy called trauma-informed therapy that you use to try to alleviate those concerns. Can you talk about what that is and how it helps people recover from a trauma and move on to the future?
Sure, it's really more about trauma-informed practices. So all of us and our staff are trained and continually trained on trauma-informed practices. What that means is that we essentially acknowledge that that most of our clients may have or have experienced a trauma. So what that also means is that they can easily become triggered. Their feelings, their thoughts become triggered, which then lead to action, which could lead to negative consequences. So for us, it's establishing the journey through therapy through this trauma lens so that someone, like we talked about before, can feel safe and trust their therapist through the process. So it starts from the very beginning at the intake call to the moment that we finish services, that we're looking at their trauma experiences and how that journey can be impacted by the therapy process.
But that's where your skill and your experience is so critical, because the average person wouldn't know, those steps to helping someone acknowledge a trauma and then move through it. And so again, there's Catholic Charities and so many clients across Cook and Lake counties. 2,400 last year, we said. They're so fortunate to have both of you and your colleagues helping them recover and try to get to a healthier place in their lives. I know also that you both of you have mentioned to me that one of the big focuses of Behavioral Health Services this year has been expanding your reach in schools across Cook and Lake County, that more schools, students have been reaching out to their parents who have been reaching out to Catholic Charities, but you've also had administrators and counselors, right, at schools reach out. How has that expanded this year in that program area for Catholic Charities this year?
This year we are at 18 CPS schools.
Wow.
We are also at 2 charter schools, and we are at some Title I schools. 7, I believe.
And so when you mention that you're there, that means Catholic Charities has an ongoing regular presence in that school, because there's that many students who need assistance.
Yes, and that helps also tear down barriers, because they're already at school. So then the counselor's there, and the school supports them in getting the services that they need during the school day.
And can you explain what some of the concerns are that these students are experiencing?
Yes. People are still experiencing effects, the kids, of the pandemic. There's a lot of anxiety that we're seeing. And then, as Hector has talked about, trauma and community violence. Those are a lot of the main focuses that we see when we're working with the kids in schools.
And so what are some of the ways, Hector, that you're able to help alleviate those concerns, anxiety, and traumatic memories of violence that they've experienced?
So that's where, like you brought before, that we are trained in evidence-based practices that target those diagnoses or those issues difficulties that clients are experiencing. For example, trauma-focused cognitive behavioral therapy. It's a big one that a lot of our staff are trained in.
And as you said, by actually having a presence in the school, the students might be a little bit more open to sharing what they're going through, because they're in their comfortable zone of being amongst their peers, and maybe it's a little more difficult to talk about these things once you get home.
Yeah, and I think it also makes it easier for parents. It takes some stress off of them of having to get them to an appointment after the school day and after a work day for the parents.
That's a great point as well. And so you're trying to help the students feel comfortable at school, eager to learn, and eager to engage in the school day, the entire school day, right? Because sometimes that has been a problem alone, that the students had become so comfortable with being at home all the time that they didn't know how to stay in school all day, right? Mm-hmm. So it's wonderful that you've been able to help them move past that. And before we run out of time here, can you just share some of the most challenging aspects of your work and some of the most rewarding that you've experienced over your long careers at Catholic Charities? Sure. Pam, can I start with you?
Absolutely. Change is constant. So change can be challenging, but it is also a great reward, because it also leads to evolution and the ability to do more to meet our clients' needs. So that, by far, I would say, is 2 sides of the same coin.
Beautifully said. Beautifully said. How about you, Hector?
I think one of the biggest challenges that our staff experience and myself is secondary traumatization, is listening, working with clients who are traumatized, and that being kind of our number one focus all the time can have an effect on us. But I think what's been great about working at Catholic Charities is that we've been able to establish put things into place to help our staff and ourselves to be able to work through those issues so that we can become more effective therapists. And I think the other thing is, just like I mentioned before, I think the joy that our clients bring, and our colleagues have been great. That's been another great thing for working at Catholic Charities.
Such inspiring supervisors and leaders, and learned not just from our clients, but so many of our colleagues.
Are you able to be a support network for each other? Because oftentimes I'm guessing when you're meeting one-on-one with the client, there's a lot of emotion on the table, there's a lot of pain on the table, and so are you able to meet as a group? And even if you never mention clients' names, at least you're able to share experiences and learn from each other as well? Is there regular opportunities to do that?
Absolutely. Yes. Team support is something that I think in both parts of our previous programs, and now we have brought to the merged behavioral health. That's just such a important component that we value very much and want to provide for our staff.
And you also tap into professionals in Chicago, right? And mental health professionals at different hospitals and different clinics, right? Aren't they sometimes advisors, or sometimes, don't you call on them to weigh in on a particular situation to just get an extra point of view?
We have.
Yeah, so I mean, that's, you've got some world-class hospitals in the city of Chicago, and so I'm sure that some of those therapists and psychiatrists have been wonderful sources of information and assistance as you're helping people.
Yeah, partnerships are so important because there's so much need out there, and we can all do more together than any of us can do on our own. So those other institutions are really important to our being able to be successful.
And really, after you've been both with Catholic Charities for so many years, are there things about the Catholic Charities mission or the message or the history that, I'm just curious, what's kept you with Catholic Charities all these years, Pam?
Oh, all of the above. The mission, for sure, the clients, and great people to work with. I mean, it has all just been a blessing, truly.
And how about you, Hector?
Same. I need to echo Pam again. The clients, the mission, and our colleagues.
Beautifully said. And then before we run out of time today, I just wonder if there's anyone in our audience who is struggling emotionally or psychologically and doesn't really know how to reach out for help, or is reluctant to do so. What would you say to them? Can I ask you to each speak to those people in the audience today? Pam, you first.
Sure. I would say give us a call. Our intake number is 312-655-7725. Call us, and cost should be secondary. If you need help and you need support, call us, and we will figure out a way to help get you the services and the support that you need.
Thank you so much, Pam. How about you, Hector?
I think the number one thing is asking for help. So reaching out to trusted friends and family, and telling them that you're really struggling with something to assist you through that process to get help.
And are there any general healthy habits in a short time we have left that you'd share with everybody to try to remain healthy themselves?
Our mental health is connected to our bodies, so be good to your body as much as you can. Everything in moderation, healthy eating, good sleeping, moderate sweets for those of us who like sweets.
They're all connected, aren't they?
Yes.
Every aspect of our health is connected. Well, Pam and Hector, I truly, genuinely have tremendous respect for the work that you do every day. Catholic Charities is so fortunate to have you both continuing to lead the behavioral health services in such significant ways. Thank you for being on the show today and helping us all better understand how addressing mental health concerns can have a positive impact in every other part of someone's life. We look forward to having you back on the show as continued updates happen in your service area. Thank you so much.
Thank you, Katie.
Thank you.
And we invite all of you back again next week for another edition of The Voice of Charity. For now, this is Katie Bredemann, and we thank you for tuning in and believing in the mission of Catholic Charities.